Monica, as a patient of kidney failure who has traveled to India for a kidney transplant but then had to come back and you underwent the surgery in Ghana, what has your experience been?
My experience after the transplant is wonderful. In fact, I was diagnosed 8 years ago and I was managing it for a year ago when the function was just going down. So like you said, I was in India, but I had challenges with the processing. And the time was running out for my donor because he had taken 4 weeks leave. So we had to come back. Well, you promised whenever I came back to India, I will have it done when everything is sorted out. But then you were looking at it, having a collaboration in Ghana. So I was just keeping my fingers crossed. Whilst I was doing the processing of my documents, I was told you were in town. So we had a chat and you promised we have the infrastructure in place so I could trust the system. And lo and behold, I had it done and everything so far has been good. As compared to my life before the transplant, I would take this anytime with the energy levels, the way you feel, it's just wonderful. So it's been good so far.
Yes. So you feel that being in your own country, administratively, it was much easier for you to undergo the transplant, and post the surgery, your sense of well-being is much better than when you were alive. So as a message to other people who may be suffering from kidney failure, what would you like to say?
I would advise any other patient who is experiencing going through this problem that they should trust the system. We have the infrastructure in place and it's convenient. You have the family around, the hotel bills and everything is down, and being in your environment is not the same as
your comfort
your
zone.
comfort
This
zone.
is
That's
home,
right.
so you are in your comfort zone. Yes.
So that alone gives you so much assurance and I have no regret.
So that's Christopher, your husband. Would you like to see? Huh? Would you like to say something? So Chris, as Monica's partner, what has been your journey like over the last year or so?
Well, the last year was difficult. It was my first experience with a kidney patient. But I was determined that we'll walk this thing through. To India, 2.5 months and back, having met you and the assurance you gave, and luckily coincided with your coming here to have the surgery. And after, gradually, there's a remarkable improvement in her weight. There's joy, there's happiness. I don't think she misses the dialysis session anymore, because that was one hell of a problem. By God's grace and with your support, we want to say that the system here is set to handle all these things.
Yes. So
And Ghana should be looked at and encouraged for all other countries to come here to have this operation done.
Wonderful. I'm so happy because you are amongst the first few patients I've had the opportunity of operating in Ghana, and that you trusted what I had to tell you when it came to undergoing the surgery, and I totally support the fact that we now have the processes in place in Ghana where a person can undergo a kidney transplant, and definitely life changes as much as the surgery is a life-changing one. So that you decided to go ahead with this journey. Wonderful. Wish you all the very best in years ahead. And we will continue our association, but now going forward more as friends, less as doctor patients.